We've talked about heart failure as a problem, so it can be due to problems like cardiomyopathies, but it can be caused by a number of different things, and actually heart failure as an entity is very important. It affects between 5 and 6 million people in this country every year, and that problem is quite a vexing one. And there are two main forms of heart failure to think about. One is what we call systolic heart failure. That is, the pumping function of the heart is diminished for many different reasons. Either heart attack has destroyed a lot of heart muscle so the heart can't pump so well, or cardiomyopathy affects it. And in those sorts of circumstances, we call that systolic heart failure. When the heart can't beat properly, we have a number of medications that we can use to try to treat that. Again, sometimes we can't affect it enough, and things like heart transplant may be required. A particularly difficult kind of heart failure is called diastolic heart failure, or heart failure with preserved systolic function, another kind of long term for it. And that's what we see when the heart muscle gets thick, or in some cases the heart is restricted in its ability to open up and take in more blood preparatory to pumping it out. And it's often seen in diabetics, and particularly in elderly women. So we think there's going to be a greater and greater population as women age, and there's a larger aging population in general. And we don't have very good treatments yet for diastolic heart failure or failure with preserved ejection fraction.